Discharge. This section of the booklet contains discharge advice in order to prepare you for returning home. Before your admission, please give some thought to how you will manage after discharge, as during the first few days at home you may feel quite vulnerable, so it is advisable to have someone at home with you during this time. Patients who have underlying conditions prior to cardiac surgery, such as mobility problems or other health conditions, may require a period of further recuperation in the form of specialised inpatient rehabilitation before returning home. If you do require a period of inpatient rehabilitation, arrangements will be made to transfer you to your local district general hospital or a provider of this specialist service nearer your home. This will be discussed in full with you by the discharge coordinator. Please discuss any concerns you have regarding your discharge home with the nurse practitioner at your pre-admission appointment, or the nurses on the ward in order for the relevant plans to be put in place. This is particularly important if you live alone and need support from social workers or convalescents. If your circumstances change whilst you are with us, please let us know. Transport home. Please ensure that you have arranged your transport home and arrange for somebody to accompany you if possible. Ambulance transport can only be arranged if your doctor considers it to be medically necessary. It can take up to 48 hours to arrange ambulance transport. Please speak to your named nurse if you have any problems. Please ensure a relative or friend brings in some suitable outdoor clothing for you to wear for you to go home. It is advisable to have them brought in at least the day before your planned discharge, and please remember to ensure your valuables are returned to you if you've given them in for safekeeping. Discharge Advice Line. The Discharge Advice Line is available for patients, relatives and carers for information and advice following discharge. You can contact a member of the discharge team directly, Monday to Friday on 0151 600 1056. The team will aim to return all calls the same or next day. Please note that calls will not be returned after 4 p.m. or at the weekend or bank holidays. The following information may answer any other questions you may have about going home. Driving. Do not drive following discharge from hospital until you've been reviewed at your outpatient appointment and advised by your surgeon that it is safe. As a result of the wound healing process, muscular strength and general agility is reduced and sudden movements can bring on pain. When driving a car or travelling as a passenger, you are not exempt from wearing a seat belt. If you find it uncomfortable, place a cushion between your chest and the belt. You must inform your insurance company of your heart surgery. Holders of LGV and PSV licence or patients who have had valve surgery must inform the DVLA. The phone number is 0300 790 6806 or www.dft.gov.uk/DVLA/medical.aspx. Bathing and showering. Take a shower or bath daily. Do not be afraid to get your wounds wet. Showering or bathing will keep your wounds clean and encourage them to heal. Do not get in or out of the bath on your own for the first 2 to 3 weeks following surgery. Apart from the danger of slipping, you'll put too much pressure on your arms and therefore through to your breastbone. This will not help the healing process and may cause damage. If possible, use a shower rather than a bath for the first 5 weeks. But if you do take a bath, remember to empty the water before you get out. Use a non-slip mat or towel before attempting to stand up, and get assistance to get out of the bath. Rest, sleep and relaxation. During the first few weeks at home, you'll find that you tire easily, so adequate rest and sleep are just as important for your recovery as exercising. Tell your friends and relatives when you are planning to rest. This will help cut down the amount of disturbance you get during this time. Try to get 8 to 10 hours sleep each night. You may find it difficult for the first week after leaving hospital, as your usual sleep pattern will have been disturbed. You may also find it uncomfortable. If you do, make sure you're taking your painkillers. You may also be more aware of your heartbeat at night, especially if had a mechanical valve replaced. You may hear it as a ticking sound. You will get used to this over time and eventually not notice it. Moods and emotions. Immediately after your operation, you may have days when you feel down or depressed. This is known as the post-op blues. You may feel irritable or overly emotional and tearful. This can happen at any time and without warning. It usually settles down within the first 2 months. Both you and your family will be affected by these feelings, so it's important that you discuss them with how you are feeling. If you're still feeling this way after a couple of months, or you feel unusually depressed, lacking concentration, or experiencing memory loss, then you should contact your general practitioner. Alcohol. You may take alcohol after surgery, but there are important notes to remember first. You should avoid it whilst taking painkillers, as it increases the potency of the drug. You should limit the amount whilst taking warfarin, as it increases sensitivity and will disrupt your clotting factor and affect the dosage you receive. Alcohol can also irritate your stomach, and this, along with a disrupted clotting factor in your blood, may cause you to have a stomach bleed. Heavy drinking or binge drinking is more harmful than small regular amounts. The recommended limits for men are 21 units per week and 14 for women. 1 unit is equal to 1/2 pint of beer, 1 pub measurement of spirit, 1 glass of wine or 1 glass of sherry. Strong lagers should be avoided as the alcohol content is higher. If you feel your intake is too high or you'd like to help, then you can contact your general practitioner or Alcoholics Anonymous. The national helpline number is 0845 769 7555. The Merseyside, Lancashire and Cheshire Council for Alcoholism is the first floor, Fruit Exchange, Victoria Street, Liverpool, L2 6QU. Telephone 0151 707 1221 or 0151 707 1300 or 0151 263 0300. If you use the internet, go to www.aa-uk.org.uk. Stress. When you're stressed, your body reacts in certain ways. Your muscles become tense, your blood pressure rises and you breathe more rapidly. You sweat and you become anxious. You can produce more sugar, fatty acids, cholesterol and adrenaline. This in turn slows down your digestive system and your immune system. So as you can see, it is in your best interest to try to avoid something that you know is going to put you in a stressful situation. Here are some suggestions that may help you cope with stress. Organise your time by making a list of what is most and least important, and do them in that order. Do not take on more than you can cope with, and try to delegate. Gentle walking or swimming will help you release tension. Try to bring your anger, worries and fears out into the open and talk about them. Avoid harmful ways of dealing with stress, like smoking, drinking or compulsive eating. These may relieve your stress in the beginning, but in the long run they will only add to it. Learn to relax. Relaxation techniques that your cardiac rehabilitation class will teach you will help, or even something as simple as doing things you enjoy. Sexual relations. Many patients that have undergone cardiac surgery experience anxiety about resuming sexual relationships. It is quite safe to have sex and/or sexual stimulation after the operation. However, we generally advise that you wait between 2 and 4 weeks to give your wounds a chance to heal. You may resume whenever you feel ready to do so, but don't be too energetic. Some of the tablets you may take may make you feel disinterested in sex. These are known as beta blockers. If the problem persists, you should make an appointment with your GP. Do not expect too much of each other. Take sensible measures and avoid putting any strain on your arms. Holidays and flying. You can holiday in this country whenever you feel well enough to travel. If you're thinking of going abroad, we advise you to wait until after your outpatient appointment. If you're thinking of taking a long-haul flight, then you should leave it longer. Check with your consultant at your follow-up appointment. If you're taking warfarin, you may need to let your anticoagulant clinic know, as they may need to adjust your dose. Cover the scars with complete sunblock when sunbathing in the first 6 months. It's also important to clarify your holiday insurance. Dietary advice. Long-term healthy eating. Once your wounds have healed and you're feeling well, you may start making dietary changes. Following a healthy diet is important in the prevention and treatment of heart disease. A cardio-proactive diet, or what is known as the Mediterranean diet, will have a positive effect on reducing coronary heart disease. Eat more oily fish. Eat 2 or 3 large portions weekly. These contain omega-3 fatty acids. There is strong evidence to show that these help protect your heart. Sardines, fresh tuna, mackerel, trout, herring, pilchards, kippers and salmon are all types of oily fish. If you do not like fish, you can buy fish oil capsules, and these contain the necessary omega-3 oils. Eat more fruit and vegetables. These give us essential vitamins and fibre, which will help protect against heart disease. Try to have at least 5 portions of different fruit and vegetables per day. 1 portion equals 1 apple, a pear, an orange, a banana, 1 large slice of melon or pineapple, or half a mango. 2 tablespoons of vegetables including beans, 1 small bowl of mixed salad, 1 glass of unsweetened fruit juice, and half a tablespoon of dried fruit. You can include raw, cooked, frozen or canned fruit and vegetables. Other sources of soluble fibre include oats and pulses such as lentils, baked beans and chickpeas. Eat less fat. Fat is an important part of our diet. However, eating too much can increase the risk of heart disease, as well as creating weight gain. Saturated fats are the ones we should try to avoid. These are found in butter, lard, ghee, the fat on meat and full-fat dairy products such as cheese, yogurt, mayonnaise and some margarines. They can also be hidden in cakes, pastries, crisps, deep-fried food and biscuits. Unsaturated fats, or polyunsaturated, or monounsaturated, are healthier and should replace saturated fat. These are found in oily fish, sunflower oil, corn, rapeseed and olive oil. Tips on reducing your fat intake: grill, bake or steam food instead of frying it. Use skimmed or semi-skimmed milk. Spread unsaturated margarine or low-fat spread thinly. Cut off visible fat from meat and remove the skin from poultry before cooking. Use a small amount of oil in cooking. Cut down on the takeaways and processed food. Salt. Common table salt is made from sodium chloride, and the sodium part of salt may be a factor in high blood pressure. Low salt should be used instead. We tend to eat more salt than we need, as many foods contain natural salt, so we should be careful about adding salt in cooking or at the table. People who already have high blood pressure should be taking steps to avoid adding salt. All processed food contains salt or sodium in other forms, especially foods such as bacon, processed meats, cheese and packets of dried food such as soups. Cholesterol. The normal levels are between 4 and 6. If you've had bypass surgery, it's essential that it is kept at 5 or below. If you don't know what your level is, ask your GP to check it about 3 months after your surgery and then again at a later date. Healthy eating is all about balance.